Good morning, everybody. It's a real pleasure for me to welcome you all to this, our 2023 Oxford Discovery Cohort Day. The photo I put in the top right is our last one, which was in just before COVID pandemic. So it's been 4 years since we've been able to have you back here, and there's a real sense, I think, of excitement and also taking stock and thinking back what we've accomplished, and also looking at our key aims going forward over the next 5 years. So welcome and thank you for coming. We've got a really great programme today, and we're going to be talking to you about key findings of the cohort over the last 10 years. And we're also going to be updating you on some clinical trials that are key to what we do, because the cohort has actually facilitated those trials happening, and our staff also take part on them. And we're going to be talking about key advances from blood and protein that we can get, as well as spinal fluid and imaging, but also talking about new studies that we need your help to recruit you to, including PPMI and new clinical trials on the horizon in Oxfordshire. Lastly, I just wanted to say a really big thank you to Jess, our project manager, Tissia and Adriana, who've helped to make this day, I'm sure, the great success that it will be. So I'm just going to start by taking stock. We've really come a long way over the last 12 years. And from 2010 to 2020, as part of the Oxford Parkinson's Disease Centre, led here by Professor Richard Martin, who's also here, we managed to recruit, with your help, over 1,000 people with early Parkinson's, and we recruited 350 people without Parkinson's, mainly from spouses of people with Parkinson's who took part in this study. And then we had a growing cohort of people with the sleep disorder, rapid eye movement sleep behaviour disorder, who have a high future risk of Parkinson's. And I'm going to just mention that we have also something to be to be really pleased about, which is that we've now secured another 5-year period to be able to continue following up the original participants, and this is through something called UP. Now, UP stands for Understanding Parkinson's Progression, and we are working through the Setup Discovery Cohort, but it's funding us from 2021 to 26. And key aims of the UP project, which is funded by Parkinson's UK, are to predict Parkinson's at the earliest stage, to also be able to tell somebody at diagnosis, what does a future for you look like, and how can you prepare and make the most of living with your Parkinson's and have the best quality of life. We're really interested in validating any biomarker changes that we find. That might be on a brain scan here, but also on a blood test, skin biopsy and others. And you're going to hear quite a lot about that later on today. And then ultimately a key aim remains to translate our findings through work with Richard, the Stem Cell Institute, into better treatments for people living with Parkinson's. So this particular 5-year funding from Parkinson's UK will allow us to establish the Discovery Cohort as one of the best long-term studies of Parkinson's worldwide, because we will be able to get follow-up from diagnosis to 15 or 16 years, which is really one of the largest and the longest studied. We are also going to be evaluating whether doing assessments for our people with Parkinson's remotely, using video assessments, using digital technology, improve cohort retention. Because as people progress, they may find it more difficult to come to clinic. There may be worse parking and issues and others. And we're actually validating whether these remote digital approaches are as good as the in-person clinic with this grant. So that's it. And then the key outcome we hope to be able to deliver to you in 2026 is a very straightforward index that will take basic information for a person at the time of their diagnosis, incorporate it with bedside and lab tests that could include your genetic profile, that might include simple clinical measures that we can gather, and that will give you an estimate, if you want to know that, of the future trajectory. And the reason for this is that at diagnosis, that is one of the first questions that people, given the diagnosis of Parkinson's, want to know. Where am I going to be in 5, 10 or 15 years? And how can I live life to the full? And how can I also prepare my family for what to expect in future? So the UP grant is a real key output of talking to patients and trying to then integrate this long-term data we're going to collect over 15, 16 years in a cohort to this prognostic index. We are already judged as a world-leading cohort because of the depth of assessment, clinical, digital, and also biomarkers we collect. And we've now had over 200 related papers from Oxford Parkinson's Disease Centre cohort since 2010. Listening to and actively involving you guys, people living with Parkinson's or carers, family members, health professionals is also key to what we do. And that helps to shape our research. And we've also shared our data and our biosamples with other Parkinson's researchers around the world in over 80 approved applications. And I think, as David Dexter said to me, the Oxford cohort is a bit like, what was it you said, the golden, something like the golden cash cow, because from a small, relatively small investment that Parkinson's UK have made, we just keep delivering because the phenotyping grows and the value of what we've collected with the long-term assessment of patients actually, starts to bring in other people who we've worked with and generated match funding from. And a key part of this going forward is also our collaboration with the GSK Oxford Institute of Molecular and Computational Medicine, who will be funding some really groundbreaking assessments on the blood, spinal fluid, and skin biomarkers that we do. So I'm just going to end by giving you an update on clinical trials in Oxfordshire. So this is a space that's moving really fast, and when I last did this in 2019, there was some studies going on, but this is really transformed. So these are studies that are actively recruiting now. We have a ketone trial where we've recruited 11 people with moderate Parkinson's, and we're looking to see whether a dietary supplement which increases blood levels of ketone benefits Parkinson's symptoms. We are recruiting to ADEPT PD, which is a trial looking at different antidepressant medication and what is most effective in people living with Parkinson's. TOPAT is a trial of a medication called ondansetron versus placebo for people who have Parkinson's hallucinations, and it's looking at what medication is most effective. OxQuip has been running in parallel with Oxford Discovery, led by Crystalline Antonides, and is still recruiting people with Parkinson's. We're going to hear an update on the exenatide PD3 trial that Jess has done a fantastic job recruiting for, and we use the Discovery cohort to select patients and do pre-screening for this trial. Now, we couldn't recruit any more people with Parkinson's to an observational cohort study in Discovery after 2010. However, the PPMI trial or cohort study is still recruiting people with Parkinson's who are diagnosed recently and able to stay off dopamine treatment for a minimum 6-month period. So we are recruiting people to PPMI with Parkinson's and RBD, as well as control participants. So if you're interested in any of these studies, please let the ladies at the front desk know. We have a research sign up and we can send you further information via email on this. Chief PD, this is a trial being led by Emily Henderson in Bristol, and it's being run out of the JR, and it's looking to see whether rivastigmine tablets reduce or prevent falls in Parkinson's versus placebo. So we're actively recruiting to this. And PD Frontline, anyone heard of this? Put your hands up if you have. Yeah, so definitely a few people heard. This is a home-based study where you sign up online, you do a saliva swab, and it looks for genetic causes of Parkinson's. And this study is the prodrome or the prelude to Aspro PD. We're going to be opening this hopefully this year in Oxford as well as multiple sites in the UK, and it's testing a cough medicine called Ambroxol versus placebo as a tablet to see if it slows down progression in Parkinson's. And I think that this study will be open for all people with Parkinson's within a criteria who don't have all genetic forms of Parkinson's compared to people with genetic forms, including GBA. Michael J. Fox has founded a trial which Oxford will be a site of, which will use an antibody given as a drip called prasinezumab in patients who have a genetic form of Parkinson's called GBA. And we'll be looking to see if we intervene early, giving this medication, whether we can prevent the onset of future dementia. So this is a really key groundbreaking trial. And then lastly, to end, Oxford and Sydney are collaborating together on the first placebo-controlled trial in people with an earlier form of Parkinson's who have this sleep disorder, RBD. And these patients are going to be randomized to an oral medication versus placebo, and the output of the study, which will be short, 12 weeks, will be changes in brain inflammation measured with a PET scan. So this is a quite complicated study looking for people, and we'll be recruiting from the discovery cohort where we have people with this sleep disorder. So that, I think, gives you hopefully a rough introduction to the landscape. I would say that each study needs to be considered in its own merit. We can provide information sheets, and we have a research sign up at the front. Please do come and see the girls if you'd like to get more information on that.